It's Dr. O, your friendly neighborhood ER doctor. If you work in the emergency department, or if you plan to work in the emergency department at some time in your career, one of the things that I need you to solidify in that perfect brain of yours is that chronically ill patients can still have emergencies. Chronically ill patients have emergencies, probably at a higher rate than the general population because they are sick at baseline. Please, please, please stop rolling your eyes. Stop getting frustrated when you see the same patients come into the ER over and over. Sometimes people have to. Sometimes people are sick at baseline. One of the things that I see pretty often in the emergency department is complications regarding feeding tubes. Oftentimes, chronically ill patients can't get the same nutrition or can't get nutrition the same ways that the general population does. And so sometimes they require feeding tubes to be able to get the proper nutrition. When we talk about complications of feeding tubes, we kind of break those into three different categories. So the first category is complications that happen immediately after a feeding tube is surgically placed. Those are post-operative complications. We also have complications that we see further on down the line, complications that happen later on after a feeding tube is placed. And then we also have a category of complications that can happen at any time once a patient has a feeding tube. Now, when we talk about post-operative complications, we're talking about the first few days after a feeding tube is placed for the first time. So these are things that can happen just after the surgery. And the three things that I probably see most commonly in the emergency department would be pneumoperitoneum, ileus, and bowel perforation. But there are some other complications that we can see in those first few days after getting a feeding tube. I've seen small bowel obstructions. I've seen a case report of, I think, what they called intrahepatic placement, where the feeding tube was actually inflated inside of the liver, which is a bad complication. I've seen volvulus after a feeding tube insertion. I've seen pancreatitis after a feeding tube insertion. So lots of things can happen in those first few days, so just be mindful that that can happen after surgery. Now, when we talk about late complications of feeding tubes, we're talking about people coming in with problems months to years after getting a feeding tube placed. And the most common ones that we see in the emergency department are related to, deterioration or erosion of the area where the feeding tube is. Skin breakdown, erosion into the subcutaneous tissues, things like that. I've seen fistulas created when feeding tubes are in place. I've seen one case of a condition called buried bumper syndrome, where the actual bumper of the feeding tube, the thing that's supposed to stop it from going in and out of the skin, got buried underneath the skin and they had to go for surgical removal. There's a risk of tumor seeding if the feeding tube is there because of cancer. The feeding tube can actually feed that cancer to other parts of the body. I've seen organs herniated. I've seen the stomach herniate through the hole where the feeding tube was. I've seen one case of intussusception after a feeding tube was placed. But the most common complications of feeding tubes fall into that last category, complications that can happen at any time when you have a feeding tube. My feeding tube stopped working. It's clogged. There's a hole in it. It broke. There's an infection around my feeding tube. We see that all the time. We see people coming in with bleeding around the side of their feeding tube or leakage of their gastric contents. And probably once or twice a month, I have somebody come in because their feeding tube got dislodged or pulled out and we have to replace it. So those are really the most common things that we see when someone's coming in with a complication of feeding tubes. But there's an array of things that can happen. So please don't write off your chronic patients. These things can happen. They are emergencies, and we're supposed to do our best to take care of them. Let me know in the comments if you want to learn more about these complications, if there's a specific one that you want to hear about, if you want to learn more about how to manage these when these patients come into the emergency department, and maybe we'll make this a series.